Hello, my name is Joey Petcher, and this is my post-COVID era presentation for UI 412. So to begin, let's get into it. So the first thing I want to talk about is the effects that COVID has had on our healthcare and pretty much country. Just the effects that it's had so far. COVID has had a very dramatic impact, obviously, not only on our country, society, but also our healthcare, which has taken, I think, a brute force of the hit due to COVID. I think that one of the biggest issues that still goes on, even today, with all these variants going around, is how full the hospitals have been getting due to patients getting admitted with COVID. Hospitals are running out of room to house people, I guess is what you could say, to admit people, and they're running out of room to admit people and keep them overnight because there's so many people coming in and out now. Now, in addition to that, there have been vaccinations that have come around that have helped out a lot with reducing hospitalization during these times of COVID, especially with the variants going around. I know I've heard about some articles saying that depending on the variant, the vaccines have no effect on it. So I don't know. Ignoring that part, they've helped reduce hospitalizations overall around the country, around the world at this point. But one of the big issues with that right now is the people that are deciding to boycott the vaccines. Now they're boycotting either because they are unsure of what's going into their body. I know that there are some people boycotting because there hasn't been enough research. They don't know the long-term effects of what might happen. I know some people are reading stuff about how there might possibly be reproductive issues later on in life with the vaccine. Now, personally, I have it, but some people are boycotting it, and that makes it hard for our healthcare system to really help out their patients and even keeping the community as a whole in the entire country safe. It's hard for them to do that because people aren't willing to take that step in towards helping fight off this virus that is killing a lot of people. And it's harder to keep those people out of the hospital if they contract COVID because, like I said, COVID is killing a lot of people. It's having a lot of respiratory issues. There's people who've been on ventilators for months due to COVID. It can have some serious effects, and it's hurting a lot of people. With these waves of COVID occurring all around the country, a lot of hospitals are also seeing burnouts with their employees. These burnouts are causing employees to leave their job because they feel they're being overworked even now. I don't know if one of the things to implement into our healthcare system would be incentives towards the workers, such as pay raises, more paid time off, something along those lines to help keep our workers in the hospital so that we can so that we don't have a shortage of workers to help fight off this virus, let alone any other things that might come along later down the road. My next slide is talking about what I think is going to change and stay the same. I didn't go into too many examples on this slide, but we'll get into that. So COVID has obviously changed a lot of lives, some for the better, and for quite a few, it has changed things for the worse. I say for the better because there are some companies and businesses that have thrived during COVID. You look at Zoom, and our entire school was using Zoom to have class just because we couldn't have anything in person. So a lot of those companies that do video chats and stuff like that, they've helped out a lot during COVID. So that's why I mentioned that some are for better. COVID has had a lot of people sent home for work, and it's brought a new normal to everyone's lives. Since everyone started working from home, it brought a lot of new ideas and even reshaping for the companies and other big businesses. They had to figure out ways to, keep a steady income for their business so they can keep their own livelihoods on top of others around themselves. it's I'm sorry, I'm losing my train of thought. Um, but it's helping them come up with new ideas on how to run their business efficiently during these troubled times with COVID. Now, before people had the option to work from home due to COVID, we had these businesses and uh, who were unsure of how to keep their businesses afloat, and in business, like I stated earlier, how to keep them financially stable. So the government came out with these COVID relief funds, and these COVID relief funds went out to individuals or businesses. Uh, they went out to pretty much everyone that were struggling with their daily lives financially because they were sent home. This was when a lot of businesses were just shut down completely, not working from home. So a lot of the relief funds went to people who were out of a job or had to be fired from their job because their company had to make the sacrifice to save money. Um, Now, later on down the line, I don't see these COVID relief funds continuing to happen. I think they will stop eventually because honestly, I think the government's losing quite a bit of money doing that. But uh, obviously, with all these stay-at-home jobs becoming more popular and more accessible for everyday workers, it's easier for these people who were living off of the relief funds to find a job to where they can make an adequate amount of money. My next slide is talking about telemedicine or telecommunication, whichever you prefer to call it. It's been around for quite some time. I remember my first time using it was a few years ago. I think it was right back when COVID started. That was my first time using it, just because that was during the beginning of COVID when everyone was scared to leave their house. So I wanted to call my doctor because I wasn't feeling well along those lines. Um, but I see telemedicine being very useful throughout these next coming years. It brings all sorts of benefits to all kinds of people. I mean, I think one of the big things or big groups that I think is going to benefit the most off of telemedicine is the people living in rural areas. I think that with these people in rural areas, they have a harder time, um, or let me rephrase that, especially now, with gas prices, some people living in rural areas have to drive 40 minutes, let's say, to a hospital. That's a lot of driving, and even with gas is expensive now. And if they're struggling with money, it can be hard for them to, you know, pay for those visits to the hospitals when you can just do it right over the phone out of the comfort of your own home. Uh, Now, assuming that a lot of these telemedicine or telecommunication companies are 24-hour services, it can help a lot of these people get the medical attention that they need, and it can benefit the patients even more than that. Telemedicine or telecommunication with physicians and doctors can really help reduce the costs of traveling to the doctor's offices and hospitals and stuff like that. But one of the big things to me is it helps reduce those waiting times at the hospitals and the doctor's offices as well. You're not sitting in the offices waiting an hour to go see your doctor. Depending on who you see on telemedicine or telecommunication, it could be 10 or 15 minutes even. I think that it's going to be a big change in the years to come due to COVID keeping people in their homes. I think it's going to have a great impact on the healthcare system. Now, this next one that I want to talk about, and my last point, is virtual reality. So, obviously, telemedicine is starting to be used more frequently, and with that technology, there's also the possibility of virtual reality coming into play in our healthcare system here soon. I know there's some people using it now in their hospitals, remote surgeries and stuff like that, but I think it'll benefit mainly the hospitals and surgery centers, even around the world, not just our country. But especially with the technology that we have today and the technology that we are continuing to expand upon, virtual reality will be used for lots of things, such as surgeries and other procedures. But just operating these machines with a technology that you can use from the comfort of your own home, if need be, can be very beneficial. Because say you have something like COVID come in and you don't want to risk your surgeons or doctors getting sick, you can use your virtual reality to perform surgeries or to do doctor visits without having to risk your doctors or surgeons um, getting sick, say with COVID. So it can be very beneficial in some parts. Now, obviously, there's going to have to be further testing and research into this idea, but I think it honestly can revolutionize the world. I think one of the big things with it coming up is incorporating 5G technology into it, both nationally and internationally. I think that if we could get 5G technology to where it can be very reliable with very few mishaps, I think that honestly you could have a surgeon from California performing a surgery on someone in New York. Because say I live in New York and I need to do Tommy John surgery, for example. It's a pretty basic procedure, but we'll act like it's a very risky procedure. If I live in New York and I don't have the funds to go out to California to pay for that trip, I could possibly have spent less having a surgeon from California perform the same surgery on me in New York. Again, I could have that top of the line doctor or surgeon that I would need pretty much perform the surgery in New York while he's staying in California. Just something to think about. I think that could be awesome. Another big thing that I think it could benefit is practice. Surgeons with virtual reality headsets and little paddles that they can control, they can practice surgeries before they go into the actual surgery to make them feel a little bit more comfortable. And I think better yet, they can even practice in the comfort of their own home. When they're off the clock, they could even perform these actual surgeries when they're at home too. I think either way, I think these are some great ideas that might be implemented into our healthcare system here soon. And that will conclude my presentation. Thank you for watching this, and enjoy the rest of your summer.